Hey guys, Kristen here. Um, let's go ahead and begin our physical exam presentation. So before beginning the newborn's physical exam, I am going to ensure that I obtain both verbal and written informed consent from the parents, being sure to explain the purpose of the exam. And as I complete my assessment, I'm going to explain my findings to them. The next thing I'm going to do is wash and dry my hands thoroughly to maintain infection control. Then I'm going to position the newborn in a supine position in a warm, draft-free environment to ensure that the newborn's temp stays regulated. So here I have my sweet newborn. She is positioned in the supine. I have her laying on top of a blanket that is on top of a heating pad to help her stay nice and comfortable while I perform her assessment. Next, I'm going to review the APGAR scores from her birth. This information gives me insight into how she transitioned from the uterus to the world. Her APGARs were great. They were 9 at 1 minute and 10 at 5 minutes. Okay, now that we've done that, let's go ahead and begin the rest of her assessment. Okay, hello, baby. I'm going to perform an assessment on you to make sure that everything on your body is nice and healthy. First thing we're going to do is we are going to assess her skin. I'm already seeing that it has pinked up nicely within the first 10 to 15 minutes of her birth. She is a darker skinned newborn. So I'm going to assess her lips, her tongue, and her oral mucous membranes. Her skin is showing great perfusion. She does have some acronosis or acrocyanosis of her hands and feet, which is normal. I am going to relay this information to the parents. I have noticed when doing these exams that a lot of first-time parents they get a little alarmed when they see those little blue hands and feet. After pressing on her skin, I am seeing that she is showing that she has a good capillary refill rate, which tells me that her blood is circulating well, which is a sign of a healthy cardiac output, and that her temperature is very well regulated. I'm not seeing anything that's concerning like central cyanosis, pallor, or jaundice. Next, I'm going to assess her vital signs and make sure that they all fall within normal limits. Let's go ahead and start with her temperature. Healthy temperature range is anywhere between 97.7 and 99.5. Her temperature is 98.4 degrees, which falls within normal limits. Now we are going to listen to her heart rate. We're wanting her heart rate to be in between 110 and 160 beats per minute. Let's go ahead and listen. Okay, her heart rate is coming in at 136 beats per minute, which is normal. And there were no murmurs present. I'm going to assess her respirations. I'm specifically looking for respiratory rate between 30 and 60 minutes. And while I'm doing that, I'm going to make sure she's not grunting, tracting, or has any nasal flaring. Okay. Her respiratory rate was 152 breath. Just kidding. Was not 152. That would be a very bad situation. 52 breaths per minute, which is within the normal range. There are no signs of respiratory distress here. Now we are going to palpate those femoral pulses. So you're going to place your index and middle fingers in the fold where the thigh meets the trunk, midway between the pubic bone and the hip bone. You're going to apply some pressure, not too much pressure, because you will not feel the pulse if you do. This assessment primarily screens for coarctation of the aorta, which is a heart defect that restricts blood flow to the lower part of their body. If these pulses feel weak, delayed, or absent compared to the pulses in their arms, it can indicate potential cardiac issues. Okay. These pulses are palpable, they are symmetric and within normal limits. Let's go ahead and assess the brachial pulses so that we can compare them with the femoral pulses. Perfect. Those were also palpable, symmetric, and within normal limits. Okay. Now I'm going to go ahead and present my assigned assessment skills, which were the plantar creases, the palmar creases, along with the suck, grasp, and rooting reflex. So the first thing I want to do is start with the palmar creases. Typically, a newborn will have two very distinct creases in the palm of their hands. A single transverse crease can be a normal variant, but it can also be associated with certain genetic conditions. In a preterm infant, creases may be present only on the anterior portion of their palm, or may be absent altogether. This assessment helps estimate gestational age. This newborn has palmar creases that are normal and bilateral. Okay, so for this next assessment, we're going to go ahead and do the newborn's suck, grasp, and rooting reflexes. So I'm going to place a glove on. Okay, I'm going to place my gloved finger into the newborn's mouth. And I am going to wait for her to latch on to that so that I can assess the strength of her suck. I also want to note that if you attempt to do this assessment after a newborn has had some time at the breast, it is possible for them to not have as strong as a suck. A newborn lacking this reflex can be an indicator of a neuro or a central nervous system condition or other developmental issues. While I'm in here, I'm going to go ahead and assess the palate, the soft palate for clefts, and arching, and feel for a submucous cleft. I really wanted to note to make sure that when you're doing this assessment to really get a good feel and visual. I did learn when researching for this assignment specifically that submucous clefts are very easy to miss on an exam because of the roof of the mouth actually appears totally normal. So if you're not familiar with those, I would Google some pictures. I believe at this time you would also assess for ties. I am not going to be doing that in this demonstration. This infant demonstrates a normal, well-coordinated rhythmic suck, and her palate is intact and normal. Next, I am going to assess her rooting reflex. To assess this reflex, I'm going to lightly stroke either her cheek or the corner of her mouth. Um, this is going to prompt her to turn her head, open her mouth, and root towards the stimulus. This reflex indicates proper neurodevelopment of specific cranial nerves. Let's go ahead and see how she's doing. We're just going to give her a little stimulus here. And oh, look at that. She's a rootin'. So she's doing a great job. She's showing me a normal rooting reflex response by turning toward my finger and opening her mouth. So for my next skill, I'm going to demonstrate the palmar grasp. This is an innate reflex, which is present at birth and indicates normal neurodevelopment and typically lasts around 5 to 6 months of age. So we're looking for symmetric, we're wanting it to be symmetric in both hands. So we'll assess one hand at each time. So I'm going to take my index finger and press it on the ulnar side of the infant's palm. The ulnar side is right along this side area where the ring and the pinky finger are. So after pressing, the infant will involuntarily curl their fingers and grasp tightly. A normal response is a nice, strong grasp. I did want to note that while sometimes it can be a temporary variation of normal for a newborn to not have a strong grasp, it often is an indicator of an underlying issue with the nervous system or peripheral nerves. This gal demonstrates a normal palmar grasp reflex. And now I'm going to assess her plantar creases. These creases are a good indicator of her gestational age and physical maturity. A newborn will typically have deep, distinct creases across, sorry, baby, probably hurts your leg, across their little feet. And a term newborn has real deep ones, real deep, distinct creases across the entire sole, from the ball of the foot to the heel. Her creases are normal bilaterally. So this wraps up my assessment. I am going to document all of my findings, and I am going to ask the family if they have any questions. All right, guys, take care. Thank you very much for your time.